Hello everyone. I have another really interesting case for you today. I have two CBCT scans submitted by an outside doctor asking us to interpret this radiolucency that he saw in both scans over a year and a half period of time. So the first scan that you're seeing here was taken about a year and a half ago, and at the time of the scan, the dentist noticed something in the in the mandible. And before telling you what it is or what he saw, I want you to see if you can determine the area that the dentist was initially concerned about. So I'm scrolling through the axial view and you can actually see it right here, but I won't tell you for a few more seconds. Now, what about in the coronal view? Let's zoom in so that it's very clear to all of us. So you're starting at the anterior part of the mandible, and as I scroll posteriorly, pay a very close attention to the root apices. Okay, did you guys all see that? We just passed through it. So because we went past, I'm going to go back and okay, I hope you all saw it. Here you go. I'm going to put my crosshair and zoom in, and that's what we're seeing right here in the axial view as well. So we see a radiolucency just at the apex of mesial root of number 19. And let me make a cross-sectional view right here. Let me bring this in right here. So you're seeing that area. Interestingly, this radiolucency is not exactly kind of centered at the apex of this tooth, and it may be, there could be several scenarios, right? That the patient, maybe this is unrelated to the tooth, as in pulpal inflammation, or there may be accessory canal that may or may not be very well visualized. One thing I know for sure is this patient is asymptomatic and the tooth test vital as well. So given that information, what would you say this is? It's primarily radiolucent with kind of sclerotic border. So now we're going to fast forward year and a half, and this is a scan that was recently taken just a few days ago. So I'm going to go to the area of interest and zoom in on the area. Also make a custom section. Okay, let's start with the custom section. And as I scroll in the AP direction, how do you think it changed over the year and a half? Like, what are the changes that you see? I think the most apparent change that I'm seeing is that it's no longer entirely radiolucent, but rather it demonstrates the radio opacities that are scattered throughout this radiolucency. So now it has become a mixed density lesion radiographically. And I may have to go back to the previous scan, but looks like there may be even more thinning of the adjacent buccal cortex. Clearly from this coronal view, we can see that mixed density nature of this lesion, which was entirely radiolucent just a year and a half ago. And we're seeing that sclerotic border. Also, let's look at the sagittal view, right? You're seeing the opacity surrounded by a thin radiolucent rim, then followed by sclerotic border, or the cortical bone in this case. Cortical plate, I mean. So what could this be? Let me remove the custom section. And also hide the crosshair. Right, this is what we're seeing. Okay, no root resorption, no displacement, thinning of the adjacent buccal cortex, a radiolucent lesion now becoming a mixed density lesion over a year and a half, tooth test vital, patient is still asymptomatic. Given the condition, I've essentially given almost all informations. What do you think this is? Another information that you may find it helpful is this patient is a middle-aged person. So based on that, what do you think this is? Love to see what you're thinking. Please write down your opinions, your ideas, differential diagnosis in the comment section below. And once I have 50 comments or more, I'll write down what I think it is. Thank you very much for your participation. I hope you find this cases helpful. Again, almost all of my cases are coming from the dental students, dental hygienists, as well as practitioners that practice outside of school, referring these cases to me for my opinion. So if you can learn from these, that's great. And that is my goal, trying to improve your diagnostic skills, radiographic diagnostic skills. Thank you very much, and I'll see you in the next video. Take care.